As parents, we get so much joy and excitement watching our children take on all of their milestones, from sitting up to rolling over, crawling, walking, but truly there's nothing better than hearing our child's first words. Dada, mama, big truck, more, please, let's watch the Packers, the best. But what if these precious milestones seem to be delayed? If you found yourself worried about your child's speech development, you're not alone. Speech delays affect 5 to 10% of preschool-aged children, with boys being 3 to 4 times more likely to be affected than girls. But there's something that might surprise you. The root cause of many speech delays could be linked to events that happen during the birthing process itself. So today we're going to explore an often overlooked factor in speech delays and introduce you to a groundbreaking approach that goes even deeper than speech therapy and OT to fully address the root cause of speech delays. This video will be powerful, especially for families who are already perhaps many months or even years into speech therapy and have seen some great improvements and gains, but have maybe plateaued or not progressed at the rate and level that you're looking for just yet. We'll be discussing the surprising links between birth interventions and speech delays and how neurologically focused chiropractic care can address the root cause of these delays. You'll learn about holistic approaches that could complement or even enhance traditional speech therapies. In our practice, we've seen countless parents struggle with their child's speech delays. They've often tried various therapies and various interventions, but the progress is sometimes slow or just inconsistent. What many don't realize is that speech delays can often be traced all the way back to birth trauma. When we dive deep into our case histories of our patient population struggling with speech delays, well over 80 to 90% of them have some documented birth intervention, such as forceps, vacuum extraction, C-section, or an induction. And studies now show that birth interventions like forceps, vacuum extraction, C-sections, and inductions, which are used in a significant number of deliveries, can potentially cause physical trauma to an infant's delicate upper neck and brainstem area. This trauma can then lead to neurological dysfunction and alter the function of the nerves and the muscles that control and facilitate speech. The physical twisting and pulling that comes with these birth interventions leads to something that's called subluxation, which is a misaligned or a fixated, stuck in neuromuscular interference dysfunction within the spinal cord system. These subluxations, particularly in the upper neck and brainstem area, can then affect the nerves and muscles that are crucial for speech production. And here's why this matters. The nervous system controls everything in the body, including speech development, and therefore these subluxations can interfere with the proper function of the nerves responsible for speech. Traditional speech therapy, while very valuable, may not address these underlying neurological issues because their exam and their assessment just doesn't look for them. Speech is a 3-step process. First, there is the perception and the input or auditory component of speech. And then second, brain and nervous system must integrate and coordinate, basically make sense of the input. Then the third step is the expression or the output of that speech. And subluxation can interfere with each step of speech formation, including the first two, the input and the coordination, which is why it escapes traditional medical and therapy assessments. While traditional speech therapy looks at speech delays as almost solely a muscular dysfunction issue, muscles are under the control of the nervous system as well. So the tone and the coordination of the nervous system matter massively. Additionally, many providers today will blame tongue or oral ties, but even those are often first caused by subluxation and tension or stress within the nervous system and the nerves themselves. This is why so many parents report to us that even after doing traditional speech therapy and even after a tongue or oral tie revision, their children will struggle with speech delays. So how can you find out if we can help? The first step to finding out if we can help a child with speech delays is in any way is diving deep into their case history. If we find things like stressful pregnancy, birth interventions, trauma, difficulty nursing, latching, torticollis, plagiocephaly, chronic ear infections, and so forth, we become extra confident that we can help. The next step then is running our neurological insight scans, which help us find and locate subluxation within your child's nervous system. And once we have this information, we can use those scan findings. We can then create a personalized and customized care plan for your child, sit down and review those right here, review the results with you in what's called a report of findings visit. If you'd like more information about subluxation and its role in speech delays, comment speech below and we'll get those resources right to you.